Hi everybody, I'm Dr. Chiu from Taipei. I'm now the manager of Genesis Clinic, which is located in Taipei. And today, I'm going to share with you my experience in fat grafting to the temple and the forehead. My topic is objective evaluation of eyebrow position after autologous fat grafting to the temple and the forehead. The study in this presentation has been published in Aesthetic Plastic Surgery in December last year. Traditionally, aging has been viewed as the cause of tissue descent and skin laxity. We can see this picture. On the left side is a beauty, right? On the right side is a old woman. But actually, this is the pictures of the same woman at a different age. On the right side, the picture was taken 37 years later. So you can see what's the change in her face. You can see that the fullness has been lost, and the clear-cut facial contour disappeared. I want you to focus on the upper third of the female, because that's the topic of my presentation today. Especially, please focus, notice the change in her eyebrow shape. The concept of aging has been changing. Nowadays, we accept volume loss as a major cause of facial aging. So the associated rejuvenation procedure has been focused on this treatment. Usually, endoscopy, brow lifting, and botulinum toxin injection have been used to rejuvenate the upper third of the face widely. But unfortunately, undesirable result could be achieved, like in endoscopy brow lifting. Over elevation of eyebrow and separation of eyebrow could be made after the surgery. As for botulinum toxin injection, an expression of surprise in terms of eyebrow position could be made. So here you can see the picture on the left side. This is a patient underwent endoscopy brow lifting 1 year before, and you can see the bizarre position of her eyebrow position. While on the right side, you can see this patient has performed botulinum toxin injection to treat the furrows on her forehead, which result in a surprising expression. Okay, so nowadays, replacement of volume loss has been used as a treatment modality to improve the aging of the face. So improved outcomes have been reported when facial volume has been dealt with during facial rejuvenation. Okay, autologous fat grafting can be used to achieve this goal of rejuvenation in the upper third of the face, because it has several benefits, such as easy to obtain, rich in source, economically in use, and capable of repairing tissue defects in the face as well as other portions of the body. But it also has some drawbacks, such as unpredictable outcomes and variable survival rates. Besides, lack of objective evaluation contributes to this problem, as many published literatures in this field focused on subjective evaluation of photographs. That's not a objective evaluation. That's why we develop and objective evaluation to assess the degree of rejuvenation after the treatment for the patient. We know that volume retention of grafted fat can be assessed with three-dimensional photograph, including Vectra 3D photography and 3D laser surface scanning, which I have been using for the assessment of the survival rate of breast volume for the patients underwent autologous fat grafting for breast augmentation. And so I have to point out that the degree of rejuvenation is difficult to be evaluated for the assessment of the degree. Yeah, so there is a published study indicated that younger patients have a medial brow that is low with an apex lateral configuration, while older patients tend to have elevated medial and middle brow, which contributes to a more flattened appearance, like in the picture shown here. We can see on the left side is a younger patient, which eyebrow shape is quite different from that in the patient on the right side. Okay, so for the definitions of medial, middle, and lateral eyebrow heights, we have three figures per side. The definition of eyebrow height is as follows. First, a horizontal plane is drawn through the medial cavity, and three vertical lines are drawn from the horizontal plane to the upper brow margin at the medial canthus, pupil, and the lateral canthus. We name it medial eyebrow height, middle eyebrow height, and the lateral eyebrow height. And we also attach a ruler on the forehead of the patient, which is manipulated on the screen of the computer to measure the heights. Okay, so besides eyebrow height, we also develop an evaluation of eyebrow slant, which is defined as the angle between a perpendicular line to the ground and a line joining upper margins of medial and middle eyebrow heights. For example, in this patient, you can see her left eyebrow slant is 100.7 degree, while on the right side, the same degree. So we can compare the result between pre-operative and the post-operative views to see if there is any change after the fat grafting surgery. Materials and methods. We included 175 patients underwent autologous fat grafting to the temples and forehead. And the follow-up time is longer than 12 months. But the patients with follow-up time less than 12 months and the history of coagulation disorders and previous botulinum toxin injection to the forehead and forehead surgeries, also and filler injection as well, were all excluded. Harvesting of adipose tissue is the same as the procedure usually performed by most of the doctors. So all the patients receive intravenous sedation and with local anesthesia to the donor anesthesia for donor sites only. For recipient sites, we do not perform any anesthesia. A Mercedes cannula with low pressure suction was performed, and all the lipo aspirated was centrifuged at 800 G for 4 minutes. So for the injection of graft, for the safety of injection of the graft, we know that it is potential dangerous to do fat grafting to this area. So we divided the recipient sites into 3 zones. Zone A comprises upper portion of the forehead with its lower border located 20 millimeter above supraorbital ring. For zone B, comprises area of temporalis muscle with its lower border above the ear, and for zone C, it is located at the lower portion of the forehead between supraorbital ring and the lower border of zone A. Can you understand what I'm talking about? Am I speaking too fast? Sorry. Okay, so for zone A and B, we perform deep injection, and for zone C, we perform superficial injection. If I have time enough, I will tell you why I do it like this later. Okay. So for post-operative care, co-compression, duodenum to the entries, no suture at the recipient site. The sutures at donor site were removed 7 to 10 days after the operation, and all the patients were asked to revisit at 3, 6, 12 months with photographs taken and the complication recorded. Okay, here is a video presentation. Okay, as you can see here, the patient was under intravenous sedation, so you can see there is nothing over her head. But sometimes you will experience the drop of oxygen. So you have to have an assistant beside you to take care of the patient's airway. Okay, that's very important. And when I perform fat injection to the temple, I do not use injection gun because I don't like injection gun. Because after years of experience, I prefer to inject the fat with 1 cc syringe. Later I will tell you why. Because I have experience to share you to avoid potential complications in this field. Okay, and left hand, non-dominant hand is very important. Like the speech Dr. Jen showed us. You have to use your non-dominant hand to tell you press the recipient side you inject. Okay, and non-dominant hand can tell you many information that you know where you should inject more, where you should inject less, where it's okay, no problem. Okay, like in now. You can see I only made 2 entries, each one on the lateral end of the eyebrow. Okay, so after the surgery, the entries need not to be sutured. You can use a duoderm, only a duoderm, to attach on the entry. Then everything will be okay. All right. The most important thing I want to tell you is that how to perform fat injection to the forehead through the entry so laterally located. Okay, the point is you have to use a curved injection cannula. Okay, because a curved injection cannula can circumvent the curvature of the forehead. Understand? Okay, so you don't need to make too many entries to complete this procedure. Okay. All right. Okay, this is our results. You can see all the patients. The mean age of the patients are 42 years old, and the BMI is 20. The volume transplanted is 42 cc, and the follow-up time is 26 months. Okay, meaning that all patients are young and thin, with slender figure. Okay, so maybe if there is another chance, I will give you my experience in how to perform autologous fat grafting in underweight women. Okay, all right, and for the objective evaluation, you can see here, medial eyebrow height is mildly decreased after this procedure, while middle and lateral eyebrow heights were increased, both mildly. But these figures were not significant statistically while eyebrow slant was increased by 2.4 millimeter degree, which was significant. Okay, that's very important. So in this picture, you can see on the left side is the patient before the operation, while on the right side is the same patient after the operation. You can see the eyebrow slant on the left side increased from 100.3 to 100.7, while on her right side, increased from 100.5 to 100.7. Although the change is subtle, but after calculation, it is statistically significant. And how about the post-operative adverse events? Our patients have, most of the patients have, post-operative edema, and almost half of them experience transient bruising. For the satisfaction rates were high, both for the patient and for the investigator. Okay, here's one typical case. This is a 40-year-old female fat grafting 27 cc in the forehead and temple per side was transplanted to her face, meaning that total 54 cc was injected into her forehead and temples. Okay, 3 months later, this is a special event for this female, because 3 months later, laser lipolysis of her lower face and submental area were performed, and upper blepharoplasty and the hyaluronic acid injection to the lips, nose, and the lower eyelid folds were also underwent. Okay, so this is the after operation picture. Okay, this is for comparison. Please notice the change in her forehead and temples. You can see the hollow temple and the retruded forehead has been corrected after the operation. Okay, so here I'm going to show you the 1/4 view. Okay, to pre-operation, post-operation. My answer is, first, fat grafting can rebuild the volume and the shape of the hollow temple and retruded forehead. Second, droopy eyebrow due to saggy temple and can be corrected after volume replacement to this area. The mechanism here resembles inflating a flaccid balloon and accordingly elevate the eyebrow position, in particularly lateral portion of the eyebrow. So there is another point that we should discuss, and there is aesthetic discrepancy in Asian women. Why? Because upper face volumization is widely accepted among Asian women, and most females in Asia hope to have a full temple and forehead. This is due to physiognomic considerations, as they think hollow temples could potentially lead to a bad relationship between couples. Okay, so apart from useful skin, oval shape of the face, and the clearly defined facial contours, we must focus on revolumization of the hollow temple and retruded forehead to rejuvenate upper third of the face in Asian women. Finally, I have one point to share with you. That is how to avoid potential complications. As you may know, in this morning, some doctors showed there is a potential serious complications such as vision loss or vascular compromise could happen during this procedure. So, in a review article, Belazane described serious complication of vision loss resulting from filler injection in the face. And the regions with highest risk were glabella, may avoid such kind of complications. A thorough understanding of the vascular anatomy is extremely important. So to minimize the risk of potential vascular complications, we divided the forehead and temple into 3 zones, and different techniques were adapted accordingly. So here is the key strategies in this paper, telling you how to avoid potential vascular compromise. But first, you have to inject the fat slowly and with minimal pressure, because inject in smaller increments in order that any filler inadvertently injected into the artery can be flushed distally. In contrast to retrograde to the ophthalmic artery, because bolus injection of the filler can lead to retrograde traveling and the subsequent arterial occlusion. So no more than 0.3 cc of filler should be injected with each increment. This principle should be used both for injection of fat and other kind of filler. Okay. Second, you have to use 1 cc syringe. Like I told you, I do not like to use injection gun, but instead I use 1 cc syringe, because when you use 1 cc syringe, you can avoid bolus injection. Okay, and besides, smaller syringes are preferred to larger ones, as a large syringe may make it more difficult to control the volume, and increase the probability of injecting a larger bolus. Okay, that's very important. Third, use cannula with the diameter no less than 18 gauge, meaning you should use larger caliber cannula. Okay, so larger caliber cannula are less likely to pierce a blood vessel. Okay, so fourth, you have to follow the principle of injection on the 3 zones. Okay, the reasons have been highlighted in the text. Okay. Finally, stop the injection and skip to work on another zone if bleeding is encountered. This is also very important, because you have to compress the bleeders and redo the injection only after bleeding stops. And because the cannula and the syringe you use, the injection pressure is low. Okay? And the risk of the IV injection is low as well. So this is also very important. So in our patients, after years of surgery, no major complications such as vision loss, infection, or uneven surface over the recipient site have been experienced. So most of the patients experience transient swelling and minor bruising after the injection site, which subsides spontaneously without the treatment within 1 to 2 weeks. The swelling spontaneously subsided. Okay. So finally, I will give you take-home messages. 1. Aging in the upper face can be corrected by autologous fat very effectively. Second, Asian women prefer having full forehead and temples. So that's also very important. Third, key strategies to prevent the potential serious complications, and follow the rules of 3-zone injection. Thank you.
Hi, I have a question. I really enjoyed your presentation. It was excellent. In Taiwan, for fat injections, do most people centrifuge, wash with lactated ringers, or just blot? I'm wondering what the most common approach is here.
You mean the processing of the lipo aspirate?
Correct.
Yes, I think most of the surgeons prefer to centrifuge the aspirate first, because according to the studies published, if the centrifugation force is under 1,200 G, then there will be no damage to the fat for grafting. Yes, so no problem with centrifugation. Yes, thank you. Does SBF ensure a higher graft take after fat grafting to the breast? No, the answer is no. Okay, the fat survival, is the same, no matter you add SBF or not. Okay, So for your question, I answer your question like this. The principle of layering injection of the fat depends on one thing. Okay? The target is to increase the survival of the fat, right? So you adopt layering technique to inject the fat. But, you know, according to my experience, once you use a solid injection method, which is described in my published article earlier, once you use this technique, you don't have to worry which layer you are injecting, you know? Once the feedback is solid, you can be sure this area is safe. Okay, no problem, you can inject your fat because the fat will survive after injection. Okay? And why I advocate for zone A and zone B, we should perform injection superficially. Why? Because to avoid intravascular injection. Understand? Okay, so if you are interested, because time is limited, okay, I know you are very exhausted right now. So if you are interested, first you can refer to my paper. You can search it on PubMed. Okay. Right. Second, if you are interested, you can later come to me. I will explain to you. Okay. Any other question?
Thank you.